Welcome to our Nurse Career Blueprint channel. I'm Nurse Miriam and I'm here to guide you through acing the NCLEX. Today we are delving into the concepts of health promotion and maintenance. Mastering this section will truly set you apart. The exam tests your ability to think critically and to understand the why behind every nursing action you take. It measures your capacity to promote wellness across the entire lifespan. This guide is specifically designed to demystify the health promotion and maintenance section for you. My goal is to provide you with the top tips and strategies that will not only help you answer the questions correctly, but also boost your confidence. You will learn to see the bigger picture of patient care, where prevention is just as important as treatment. So, let's begin this journey together and unlock the secrets to mastering health promotion and maintenance on the NCLEX. You've got this. The health promotion and maintenance section emphasizes the nurse's role as an educator. Nurses are the primary source of health information for patients and their families. This tests your ability to translate complex medical knowledge into simple advice. This educator role is directly linked to your function as a patient advocate, ensuring they have the information to make informed decisions. The NCLEX presents scenarios where you must identify teaching opportunities and intervene early. Advocating for preventive measures impacts patient care outcomes. You are not just studying for a test. You are preparing to be a transformational force in healthcare. Educate with compassion and advocate with conviction. What is the health promotion and maintenance section of the NCLEX? It's the blueprint for proactive nursing care, not just treating existing diseases. It tests your ability to actively support health and prevent illness. Covering a vast range of topics central to your practice, you'll need to understand the entire human lifespan. From newborns to the elderly, knowing developmental milestones is key to early intervention. This section's scope is broad, reflecting the diverse responsibilities of a modern nurse. Expect questions on prenatal and newborn care, nutrition, and immunization schedules. Knowing when to screen for diseases is crucial for community health. Be prepared for personal topics like family planning and STI prevention. The NCLEX emphasizes lifestyle choices, requiring you to assess diet, exercise, and substance use to promote positive change. Health promotion accounts for 6-12% of the NCLEX exam. Mastering this is foundational to safe, effective nursing. Now that we know what is covered in this section, let's talk about why it matters so much, both for the NCLEX and for your future nursing career. This content area is a direct reflection of the evolving role of the nurse, which has shifted significantly from being a task-oriented caregiver to a holistic health partner. The health promotion and maintenance section is designed to test your ability to be an educator, an advocate, and a change agent. A nurse who excels in health promotion can significantly reduce hospitalizations. By educating new parents on safe sleep practices, you can prevent a tragic outcome. This skill, the ability to prioritize interventions, is a hallmark of an expert nurse. It's about believing that every patient has the potential to live a healthier life and that you, as their nurse, can be the catalyst for that change. This part of the NCLEX is your opportunity to demonstrate that you are not just a nurse who follows orders, but a leader who actively promotes lifelong wellness. Understanding growth and development is fundamental to your role as a nurse, and the NCLEX will test it thoroughly. Think of developmental milestones as the roadmap that guides your assessment, from newborn to adolescent. Knowing these milestones allows you to quickly recognize what is normal and what might be a red flag. For example, a 6-month-old infant should be able to roll from back to stomach and might be starting to sit with support. Infants should double their birth weight by 6 months and triple it by their first birthday. The exam will also assess your knowledge of cognitive, social, and emotional milestones like object permanence. Socially, look for a social smile around 2 months and a stranger anxiety around 8 to 9 months. This knowledge will enable you to confidently answer any NCLEX question and provide excellent care to your littlest patients. As toddlers grow, their world expands with new skills and a drive for independence. Parallel play is a hallmark. Toddlers play near others but not cooperatively, which is normal at this stage. Language explodes by age 2. Expect 2 to 4 word sentences and a vocabulary of 300 words. If a 2.5-year-old isn't using simple phrases, that's a red flag. Nurses should encourage parents to read, talk, and name objects to boost language. Preschoolers ages 3-5 shift to associative and cooperative play, engaging more with peers. Imaginative play and magical thinking dominate. Think imaginary friends and make believe. Erickson's initiative versus guilt. Preschoolers need encouragement to try new things like dressing themselves. Teaching must be simple and concrete. Avoid confusing phrases when explaining procedures. For example, say special nap instead of put to sleep before anesthesia. Age-appropriate communication is a critical nursing skill. Mastering these milestones ensures safe, effective, and compassionate care. Know these stages for NCLEX success and real-world practice. School-age children 6 to 12 focus on mastering skills and building confidence. Erickson's industry versus inferiority praise and accomplishment are key. Nurses should encourage activities that foster competence, sports, music projects. Health teaching should be direct and logical. Explain the why behind habits. Teach safety helmets, seat belts, and stranger awareness. Adolescents 12 to 18 face identity versus role confusion. Peers and independence matter most. Respect their autonomy and provide a confidential space for sensitive topics. Prioritize teaching on immediate psychosocial concerns, body image relationships, stress, and substance risks. Connect on their level to build trust and address long-term health. NCLEX will test your ability to tailor teaching to these developmental needs. Understanding these stages ensures your teaching is impactful. Support their growth with age-appropriate education and empathy. Your guidance shapes their lifelong health habits. Immunizations are vital for protecting individuals and communities. Know the standard schedule. Timing is everything for effective protection. First, hepatitis B dose at birth before leaving the hospital. Key infant vaccines at 2, 4, and 6 months. DTaP, IPV, and PCV13. Pneumonia. I am happy to move forward for DTaP at 2, 4, 6 months plus a booster. At 12-15 months first, MMR and varicella live vaccines. NCLEX will test your knowledge of these timelines and your ability to educate parents. Teach about common side effects and when to seek help for severe reactions. Patient education is as important as knowing the schedule. Confident, clear guidance builds trust and ensures compliance. Mastering immunizations is non-negotiable for nurses. protect public health, know your vaccines. Screenings catch chronic conditions early, improving outcomes, no guidelines for cancer, hypertension, and cholesterol for all ages. Pap smears start at 21 every 3 years. Mammograms begin at 40 or 50 based on risk. Colorectal cancer starts screening at 45. Colonoscopy every 10 years if normal. The NCLEX may ask who is due for which screening. Know the age markers. Blood pressure, check routinely for adults. Cholesterol start in young adulthood. Frequency varies by risk. Nurses must educate, perform, and interpret screenings. Early detection saves lives. Proactive teaching is key. Master these guidelines for effective health promotion. Your knowledge empowers patients to take control of their health. Preventive care is a nurse's superpower. Reproductive health education must be knowledgeable and non-judgmental. Teach about contraception options, hormonal, barrier, and long-acting methods. Folic acid before and during early pregnancy prevents neural tube defects. Nutrition, safe exercise, and avoiding teratogens are essential prenatal topics. STI education, risk reduction, condom use, and regular screening. Provide information clearly and confidentially to build trust. Empower clients to make informed reproductive choices. NCLEX will test your ability to guide clients through these topics. Your teaching shapes healthy families and safe pregnancies. Communication and knowledge make the difference. Nurses must identify and prioritize health risks for effective promotion. Distinguish non-modifiable age, sex, genetics from modifiable lifestyle risks. Focus teaching on what patients can change. Smoking, diet, activity, alcohol, weight. NCLEX will ask you to prioritize interventions based on risk, severity, and number. Use critical thinking to target those with the most modifiable risks. Triage educational needs. Focus where you'll make the biggest impact. Prioritization is key to efficient, effective care. Targeted teaching improves outcomes and demonstrates clinical judgment. Strategic education is what sets great nurses apart. Apply your knowledge to promote meaningful health changes. Make every teaching moment count. After identifying modifiable risk factors, provide education that inspires lasting change. True health promotion requires a personalized approach, considering cultural background, health literacy, and beliefs. The NCLEX will assess your ability to tailor teaching methods. Use motivational interviewing to guide patients to discover their own reasons for change. Your teaching plan must be realistic and achievable, setting small incremental goals. Successful education is about empowerment, providing tools and support. Partner with patients to help them build healthier lives. All right, future nurses, it is time to put your knowledge into practice. The best way to prepare for the NCLEX is to work through questions that mimic the style and complexity of the real exam. I have prepared 2 original NCLEX style questions that cover the key areas we have discussed: developmental milestones, age-appropriate teaching, immunization schedules, screening guidelines, and lifestyle modification. As you read each question, take a moment to think critically. Identify the core issue. Consider the age of the client and apply the nursing process. This is your chance to test your understanding and identify any areas where you might need a little more review before the big day. Let's begin with our first scenario. Question 1, infant development. A nurse is performing a developmental assessment on a 9-month-old infant during a well child visit. Which of the following milestones should the nurse expect the infant to have successfully achieved it? A. Walking independently around furniture. B. Saying 3 to 5 distinct words. C. Sitting up steadily without any support. D. Using a pincer grasp to pick up a small object. Question 2, adolescent teaching. A school nurse is planning a health promotion session for a group of 15-year-old high school students. Which topic would be the most appropriate and engaging for this specific age group? A. Strategies for managing early onset hypertension. B. The importance of long-term retirement planning. C. Education on acne, body image, and peer pressure. D. A detailed demonstration of breastfeeding positions. Let's break down the rationales behind these questions. Understanding why an answer is correct and others incorrect builds critical thinking for NCLEX success. For the infant development question, the correct answer is C. Sitting up steadily without support, typically achieved by 8 months. In the adolescent teaching question, C is correct. Education on acne, body image, and peer pressure. Adolescents are in Erickson's identity versus role confusion stage, making this topic most relevant. Please subscribe for more great nursing school and NCLEX prep videos. Please download a free NCLEX Ultimate Study Guide available at nursecareerblueprint.com. Recap: the American Cancer Society recommends women at average risk have the choice to begin annual screening at age 40. Knowing current evidence-based recommendations promotes early detection. As we conclude our exploration of health promotion and maintenance, remember its crucial role in your NCLEX success and future career. This section tests your ability to apply knowledge across the lifespan, considering diverse age groups and prevention strategies. Mastering this is about developing a proactive mindset. Focus on age-specific interventions. Teaching a toddler differs greatly from guiding a teenager or older adult. Keep prevention in mind. Ask, what can I teach to prevent or mitigate this? Use memory aids for complex info. Apply the nursing process. Assess, diagnose, plan, implement, and evaluate. Your ability to teach knowledge transforms you. Health promotion is about partnering for healthier futures. Embrace your role as educator and advocate. You are more prepared than you think. You've got this. See you in our next video.